Insomnia causes, symptoms, and remedies. Staring at the ceiling with your mind still busy working, you desperately need some rest after long hours of work for tomorrow's important presentation. But the more you want to sleep, the more awake you are. That can be an insomnia condition you are facing. Hi there, this is Jenny. You may experience insomnia once in a while, but it can also be a chronic problem. Insomnia is a common sleep disorder characterized by difficulty falling asleep, staying asleep, waking up too early, or experiencing poor sleep quality. Addressing the issue is crucial, as about 10% of the world's population experiences insomnia that qualifies as a medical condition. What are the causes of the problem? Sleep is crucial for our health and overall well-being. The amount of sleep needed varies from person to person and changes throughout life. Infants need significantly more sleep, between 14 and 17 hours per day, while most adults need about 7 to 9 hours per day. Many factors can lead to insomnia, including health conditions, lifestyle factors, environmental influences, and medications. There are immediate or short-term triggers, as well as many underlying causes. Environmental factors. An uncomfortable sleeping environment, such as noise, light, and temperature, are mainly immediate triggers of insomnia and poor sleep quality. Some people don't feel safe in their homes, such as situations involving repeated violence or abuse. Brief or temporary changes, including jet lag, sleeping in an unfamiliar place, or adjusting to a new work schedule, especially shift work, can affect sleep. Your body's internal clock, known as circadian rhythms, guides your sleep-wake cycle, metabolism, and body temperature. Disrupting these rhythms can lead to insomnia. Mental health issues. About half the people with chronic insomnia also have at least one other mental health condition, such as stress, anxiety, and depression. Negative feelings can be caused by personal concerns about work, school, health, money, family, and stressful life events, such as the death or illness of a loved one, divorce, or a job loss. However, even positive significant life circumstances such as marriage, home moving, promotion, or traveling can bring stress together with excitement. These emotions and mental issues keep your mind active at night, making it hard to fall asleep. Medical conditions. Physical and mental health conditions play major roles in contributing to sleep disturbances. They can be temporary illnesses like minor infections or injuries, or chronic conditions like acid reflux, ongoing pain, cancer, diabetes, heart disease, asthma, gastroesophageal reflux disease, GERD, overactive thyroid, Parkinson's disease, and Alzheimer's disease. Conditions that affect your circadian rhythm, your body's natural sleep-wake clock, are also factors. Sleep-related disorders, such as nocturnal panic attacks or nightmare disorder, disrupt your sleeping patterns and quality, with fear or anxiety about sleep. Sleep apnea causes you to stop breathing, at times during the night. Restless leg syndrome causes a strong, uncomfortable urge to move your legs. This may keep you from falling asleep or getting back to sleep. Hormonal imbalances occur with a woman during the menstrual cycle or pregnancy may play a role. During menopause, night sweats and hot flashes often disrupt sleep. Medicines. Many prescription drugs, such as certain antidepressants and medicines for asthma or blood pressure, can interfere with sleep. Over-the-counter medicines, including some pain relievers, weight loss products, allergy, and cold medicines, contain caffeine and other stimulants, and may also disrupt sleep. Lifestyle factors. You may not be aware, but your insomnia may be an accumulation of many lifestyle routines all along. These sleep hygiene practices include an irregular schedule, diet, and other poor sleep habits. Going to bed and waking up at different times each day or taking naps can disrupt the natural sleep-wake cycle. Some children and teens have trouble getting to sleep or resist a regular bedtime because their internal clocks are more delayed. Being too active, whether working or entertaining, before bedtime keeps your mind running, making it difficult to sleep. Using computers or smartphones, playing video games, or watching TV just before bed can disrupt your sleep cycle. Eating too much late in the evening is not only bad for digestion, it may also cause discomfort while lying down, and even wake you up with heartburn. This is when stomach acid backs up into the esophagus, the tube that carries food to your stomach. Consuming caffeine from coffee, tea, Red Bull, and certain soft drinks in the late afternoon or evening can keep you from falling asleep at night. Nicotine in tobacco products is another stimulant that can disrupt sleep. Alcohol may help you fall asleep, but it prevents deeper stages of sleep and often results in waking up in the middle of the night. Aging. You may think older people need less sleep, but it is not entirely accurate. The amount of sleep needed remains relatively consistent throughout adulthood, but seniors often have more difficulty falling asleep, staying asleep, or experiencing fragmented sleep due to changes in sleep architecture. Sleep becomes less restful as you age, as there is a decrease in deep sleep, slow-wave sleep, and an increase in lighter sleep stages, such as stages 1 and 2. Your internal clock often moves forward in time, so you get tired earlier in the evening and wake up earlier in the morning. Retirement, reduced physical activities, lacking social engagement, less exposure to natural light, and taking daytime naps can disrupt a good night's sleep. Ongoing pain from conditions such as arthritis or back problems, respiratory issues, or sleep disorders may lead to more awakenings. The increased need to urinate during the night, such as prostate or bladder problems, adds another interference to quality sleep. The use of more prescription drugs raises the chance of insomnia related to medicines. Common types and syndromes. Insomnia can manifest in different types and syndromes, each with its specific impact on daily life. It can be categorized as short-term or long-term insomnia. Acute or short-term insomnia can last for days or weeks, usually triggered by temporary factors, such as stress, jet lag, a distressing event, or changes in your schedule or environment. Chronic or long-term insomnia, on the other hand, occurs 3 or more nights a week, lasting for more than 3 months. It may be regarded as a chronic insomnia disorder if it happens without interference from external factors, such as time or environmental influences, life events, medication, or other health conditions. Insomnia can drain your energy level, make you feel sleepy during the day, impact your mood, cognitive function, and quality of life, leading to lower work or school performance, long-term diseases, and a higher risk of accidents. Common symptoms of insomnia include sleeping problems. There are 3 main ways sleeping problems can occur, and people commonly shift between them over time. Initial sleep onset insomnia means trouble falling asleep. Middle maintenance insomnia refers to waking up in the middle of the night, but being able to fall back asleep. It's the most common form, affecting almost 2/3 of people with insomnia. Late, early waking insomnia means you wake up too early in the morning and can't fall back asleep. Daytime effects. Disruptions in sleep, like insomnia, commonly cause symptoms that affect you while you're awake. These include feeling tired, unwell, fatigued, or sleepy during the day. Having difficulties paying attention, staying focused on tasks, or remembering. Confusion and decreased productivity. Making more errors or having a higher risk of accidents. Slowed thought processes and delayed responses, such as reacting too slowly when driving. Mood disruptions, especially anxiety, depression, and irritability. Disruptions in your work, social activities, hobbies, or other routine activities. Long-term impact. When insomnia is severe or lasts a long time, it causes sleep deprivation. Some may develop ongoing worries about sleep, which, in turn, worsen the situation, forming a vicious cycle. Chronic insomnia raises your risk of high blood pressure, hypertension, coronary heart disease like heart attack or stroke, obstructive sleep apnea, type 2 diabetes, obesity, and cancer. Common solutions. Ways to treat insomnia, ranging from simple lifestyle changes to medications. The main approaches to treating insomnia include the following. Good sleep hygiene. Developing and practicing good sleep habits can significantly improve your insomnia and overall sleep quality. Some important sleep hygiene practices include: establish a regular sleep schedule. Your body functions best on a routine, so try to wake up and go to bed at the same time every day, even on weekends or vacations. Avoid taking naps in the late afternoon, as they can disrupt your sleep cycle. Create a comfortable sleep environment. Ensure that your sleeping environment is conducive to quality sleep. Consider factors like lighting, sounds, and temperature. While most people prefer a quiet environment, some find specific sounds, such as white noise or certain Hz frequencies, helpful for sleep. Tools like earplugs and white noise machines can assist as needed. The ideal temperature for sleep is around 18.3 degrees Celsius, 65 degrees Fahrenheit. A dark room is typically preferred for falling and staying asleep. Use thick curtains or blinds to block out light that may wake you up, or try using a sleep mask. Instead of turning on bright overhead lights, consider using small dim lamps with motion detectors in the bathroom and along the corridor. Reserve your sleeping space solely for sleep and adjust the environment according to your preferences. Get in the right frame of mind for sleep. Try to complete your most demanding tasks earlier in the day and allow for a buffer period between work and bedtime. If you can't fall asleep within 20 minutes, get out of bed and engage in relaxing or calming activities, such as a hot shower or drinking warm milk, whichever works best for you. Excessive worrying about sleep can make it even harder to fall asleep. Minimizing screen time. Avoid using screens, such as TVs, mobile phones, computers, video games, and other electronic devices, 1 to 2 hours before bed. The light emitted by these devices can have a stimulating effect and disrupt the release of chemicals that signal your brain and body that it's time to sleep. Lifestyle changes. Certain lifestyle choices can significantly impact your sleep quality. Consider the following changes. Mind your dining habits. Avoid consuming large meals within 3 hours of bedtime. Additionally, limit your caffeine intake to the earlier part of the day and avoid alcohol after dinner. Regular exercise. Engaging in moderate exercise for at least 20 minutes per day can boost overall health and improve sleep quality. You may also incorporate strength training or vigorous aerobic exercises a few times per week. Avoid exercising within 2 hours of bedtime, as exercise releases endorphins that can make you feel awake and energized. Practice relaxation techniques. Stress and emotional factors can contribute to insomnia. Engaging in relaxation practices and stress management techniques can be beneficial. Mindfulness meditation involves slow, steady breathing while sitting quietly. It can reduce stress, improve concentration, and boost immunity. Yoga practice has been shown to have a positive effect on sleep quality by alleviating stress, improving physical functioning, and enhancing mental focus. Tai Chi combines slow-motion movements, meditation, and deep breathing. It promotes the body's qi energy flow for better balance, mobility, coordination, and peace of mind. Seeking support from friends, family, or mental health care professionals if insomnia is triggered by significant life events. Complementary or alternative treatments. In addition to conventional approaches, certain complementary or alternative treatments can be used to address insomnia. These include: hypnotherapy is a mind-body practice that uses hypnosis to address underlying issues that are preventing you from sleeping. Massage therapy helps muscle relaxation, improves sleep quality, and reduces pain, anxiety, and depression. Acupuncture involves inserting tiny needles into specific reflex points on the body. It can regulate the body's yin and yang to reinforce health and eliminate pathogenic factors, leading to improved sleep. Medications. Various medications can help with falling asleep or staying asleep. Sedative drugs reduce nervous system activity, hypnotic drugs induce sleepiness, and certain medications for mental health can also be prescribed. It is essential to consult healthcare professionals to find the medication that suits your needs. Insomnia medications are to be taken shortly before bed and avoid driving or engaging in activities that require concentration afterward. Nutritional solutions. Optimizing your nutrition can support your body's natural sleep-regulating mechanisms and address potential deficiencies that may contribute to insomnia. Several specific nutrients have been linked to improved sleep quality and can help manage insomnia condition. Magnesium. This mineral helps regulate neurotransmitters involved in sleep, helps muscles relax, and relieves stress. Good food sources of magnesium include leafy greens, vegetables, nuts, seeds, whole grains, legumes, and dark chocolate. You may also add 1 cup of magnesium flakes to your evening bath to absorb through skin. Melatonin and vitamin B6. Vitamin B6 is essential for melatonin production, a hormone that regulates sleep-wake cycles, and can be helpful for issues with your body's internal clock, such as jet lag. Because of its calming and sedating effects, melatonin is also called the sleep hormone. Food rich in melatonin and vitamin B6 include eggs, lean meats, poultry, fish, bananas, cherries, walnuts, and tomatoes. Tryptophan and calcium. An amino acid that is converted into serotonin and melatonin, tryptophan promotes relaxation and sleep. In the conversion process, calcium is required. This is why dairy products, which contain both tryptophan and calcium, are one of the top sleep-inducing foods. Other dietary sources of tryptophan include turkey, chicken, eggs, nuts, seeds, and tofu. Omega-3 fatty acids. Found in fatty fish, flax seeds, and walnuts, omega-3 fatty acids can reduce inflammation, help with circadian timing, promote brain health, and have been linked to better sleep. Herbal teas. Certain herbal teas have calming properties that can aid in sleep. Chamomile, valerian root, lavender, passion flower, and lemon balm teas are known for their relaxing effects. Sipping a warm cup of herbal tea before bed can help create a soothing bedtime routine. Health supplements. Sometimes it can be challenging to obtain all the required vitamins and minerals solely from food sources. In that case, consider including high-quality comprehensive supplements to ensure a well-balanced intake of multivitamins, minerals, and trace elements. That is all for today. Thank you for watching. Please subscribe, like, and share this channel to receive more updates on health and anti-aging. If you have any specific topic that you are interested in, let me know in your comments. Bye for now and see you again soon.